Hi, everyone. Welcome back to another episode of Psychiatry Rewritten. I'm excited. Today I have a co-host who is my best friend. Her name is Jami. She is a family nurse practitioner and she works in detox. So before we dive in, I just want to say how lucky I feel to be doing this with my best friend. She's one of those rare people who's smart, grounded, and actually gives a shit about mental health, addiction medicine, and just people in general. Like, she cares about the whole human, not just the diagnosis. And somehow she manages to do all that without being annoying about it, which is impressive. I've learned so much from her over the years, and honestly, I'm just really glad you all get to hear from her too. So, the real question, when you hear the word schizophrenia, what's the first thing that comes to your mind?
Well, if I'm being honest, before I started working in healthcare, I probably would have said something dramatic, something like you would see in a movie, somebody just standing in a dark hallway, talking, going off the rails. But now that I work in detox and I've worked in the ER, I've seen people in psychosis up close. And most of the time, I still don't always know what I'm looking at, how to explain what I'm seeing, or how to even really talk about it. And when I see something crazy like that, I normally come to you and I'm like, hey, what the hell's going on?
Yeah, and I like that we can be there for each other. If I have something with health, with FMP stuff, I can ask you. Same with PMHMP stuff, so that's nice. And that's where we start. Because schizophrenia might be one of the most misunderstood and most stigmatized diagnoses in psychiatry. People think dangerous, they think crazy, they think split personality, and almost all of that is wrong. So we'll start with the first myth buster. The first myth is schizophrenia means you have multiple personalities. The truth is that is dissociative identity disorder, which is completely different. Schizophrenia has nothing to do with split personality.
Yeah, I've had patients tell me they've been called schizophrenic or even diagnosed with schizophrenia just for being emotional or paranoid or shut down or even having hallucinations related to substance use.
Yeah,
It's like the word gets thrown around when someone doesn't know what to say or they hear the word
exactly.
hallucination and that's immediately what their mind goes to.
Mhm. Schizophrenia isn't about acting weird. It's a chronic brain disorder that affects how someone thinks, feels, and perceives reality. It affects so many things. And we don't understand it when we reduce it to stereotypes. We stop seeing the person behind the symptoms.
Yeah, and I feel like working in detox, it's even more complicated. Sometimes someone is hallucinating or paranoid, and it's not even schizophrenia. It's withdrawal, trauma, sleep deprivation. But once that label's in the chart, it sticks.
Yeah. That's one of the biggest problems. People either get missed entirely or they get mislabeled and then no one questions it.
Yeah, somebody can have one episode of maybe meth-induced psychosis, hallucinating, and they get labeled schizophrenic, and then they think for their entire lifetime, I have schizophrenia, even when it's not that.
Exactly. And so, a quick reality check, schizophrenia affects about 1 in 100 people worldwide. That's roughly 24 million people globally. And that's according to the World Health Organization. But those people are 14 times more likely to be the victim of violence than the perpetrator.
Yeah, those stats blew my mind the first time I heard them. First off, 24 million people globally, that's a lot more than I would have ever thought or guessed, to be honest.
Mm.
And we think dangerous, but they're usually the ones getting hurt, not doing the hurting.
And here's the part no one talks about. People with schizophrenia don't usually die from psychosis. They die from suicide, cardiovascular disease, or neglect. The average life expectancy is 15 to 20 years shorter than the general population, not because their brain is broken, but because the system is. This episode, it's not about shock value. It's about truth. It's about what schizophrenia actually is and what it isn't. Because this diagnosis doesn't make someone dangerous. It doesn't make them hopeless. And it doesn't make them less human.
And if we really want to help people, especially in places like detox, crisis units, and primary care, we have to unlearn what we've been taught.
Exactly. Coming up next, what schizophrenia actually looks like. The real symptoms, the spectrum of related disorders, and why it's more nuanced and more hopeful than most even realize. All right. So let's get into what schizophrenia actually is. Because most of what people think they know, it's either wrong or wildly incomplete.
Yeah, I'm honestly so glad we're doing this episode. I feel like I have asked you so many times, like, what is schizophrenia? What's schizoaffective? Let's talk about it. Just because working in detox, I hear so many people say, I'm schizophrenic, I'm schizophrenic. And many people come through with psychotic symptoms. And I'll be honest, it's not always clear if it's schizophrenia, substance induced, trauma, or what is going on. And I just really want to understand better.
Yeah. And honestly, don't you think that was a theme in the emergency department too? When we worked in the ER, it seems like people would come in there and we wouldn't know, what the heck was going on at first.
Right, especially if they're in a psychotic state, they aren't able to give you valid history and let you know really what has been going on in their medical history.
Exactly. It's messy. And what most people don't realize is that schizophrenia isn't just one disorder. It's part of a spectrum, a family of diagnoses that all share similar core features, but show up differently.
So what you're saying is it's not just you have it or you don't.
Right. No, it's more layered than that. So here's a quick rundown of what falls under the schizo umbrella. There's schizophrenia, the classic one, hallucinations, delusions, disorganized thinking, and negative symptoms that last at least 6 months. Then there's schizoaffective disorder, schizophrenia plus a mood disorder, usually major depression or bipolar. You can imagine how difficult that is to cycle between moods and then also have all the traditional classic schizophrenia symptoms. And then there is schizophreniform disorder, same symptoms, but shorter, between 1 and 6 months. Then we have delusional disorder, which is persistent fixed beliefs like paranoia or jealousy without other psychotic features. There's also brief psychotic disorder, which has a sudden onset, usually under a month, often tied to extreme stress or trauma. And then lastly, we have schizotypal personality disorder. And that's mentioned and explained in more depth in another episode that I will be releasing very soon. And schizotypal personality disorder doesn't involve full psychosis, but there's magical thinking, odd behavior, and serious social anxiety.
All right, that's a lot. I didn't even know some of those even existed. So in detox, when I see someone with paranoia or hearing things, it might not be schizophrenia.
Exactly. Like substance induced psychosis is very real, like you said, and sometimes it goes away, but sometimes it unmasks an underlying condition that was already there.
Okay. So how do you even tell the difference?
That's a great question. We'll actually break that down later when we talk about onset. But for now, it's about understanding the core symptoms that show up across the spectrum. There are three main categories. One, positive symptoms, meaning things that are added, like hallucinations or delusions. And then two are the negative symptoms, which are things that are missing, like motivation, pleasure, or emotional expression. And then the third are cognitive symptoms, stuff like memory, organizing, planning, and focus.
Okay, wait. What do you mean by positive and negative? That has always confused me.
Totally fair. Positive doesn't mean good. It just means something is there that shouldn't be, like hearing voices. That's not a normal part of perception. So it's a positive symptom. It's like it's added on. And then negative means things that should be there, but aren't, like they've been taken away, subtracted, negative, like smiling, initiating conversation, or feeling joy. Negative symptoms are actually more predictive of poor long term outcomes than hallucinations or delusions.
Wow, that makes sense. I've seen people who aren't in full psychosis anymore, but they're still just not themselves. They're flat, withdrawn. I didn't realize that was a part of the illness too.
So, moving on to more myth busting. Here's a myth we've got to bust while we're here. Listen, people with schizophrenia are totally disconnected from reality all the time. The truth is, insight actually varies. Some people know exactly what they're experiencing, they just can't stop it. So they know that they have a mental illness. They know that they are experiencing hallucinations or delusions, but they can't control them. And then others might not realize anything's wrong at all. That's called anosognosia, a neurological lack of awareness.
That actually reminds me of a patient I had who kept saying, "I'm not sick. You just don't understand." And he was so convinced, like deeply. And I didn't know if me, the envelope there, would make it worse.
Yeah, that's a classic bind. And sometimes trying to convince someone they're psychotic when they truly believe otherwise just leads to more distrust. That's where relationship and rapport matter way more than confrontation.
So, do you feel like building a good rapport would be better to do first and then possibly like confronting the issue there, pushing it a little bit.
I think that building rapport first is definitely super important because I just think that you have to start with that and start with a good foundation in order to ever move on.
Okay. And yeah, and on the topic of having a good rapport, I feel like having good rapport with any of your patient, any type of patient, it doesn't matter what they're there for, who they are, what their diagnosis is the most important. But can I ask one more thing?
Always.
The voices. Is it always scary or angry, or do people ever have like kind voices?
That's a great question because I always think about that. I always have thought about that since I was young, watching people in downtown city of Pittsburgh, a lot of homeless men talking to themselves. And I would ask my dad a trillion questions about it. And I think it really depends. Some voices are terrifying, yes, but others feel comforting, familiar, like a parent or even a divine presence. About 70 to 80% of people with schizophrenia report hearing voices at some point. And here's what's wild, it's not always external. Some people hear the voice inside their own head, but it doesn't feel like them.
That must be exhausting and confusing all at the same time. It's confusing to me, and it's not even happening to me. So I can't even imagine what they're feeling and going through.
Yeah. And yeah, it has to be. And you add in the cognitive symptoms like trouble concentrating, memory loss, decision fatigue, and suddenly everything from holding a job to remembering your meds becomes 10 times harder. So, yeah, schizophrenia isn't just about crazy behavior, it's layered, it's neurological, it's so often misunderstood. And in the next segment, we're diving into when it starts, how people get missed, misdiagnosed, or dismissed, especially in the early stages.
Yes, please. I've seen it firsthand, but I've never known how to really catch it early. Let's talk about what gets overlooked, especially in teens, in trauma survivors, and in people who use substances.
And that's the whole issue. Schizophrenia gets tossed around like a buzzword, but what people picture is often way off. They think of danger, chaos, split personality. All these myths are baked into how we talk about it.
Yeah. And wait, that's not even accurate, right? Schizophrenia isn't the same as multiple personalities.
Exactly. So let's bust that myth right now. The myth that schizophrenia equals multiple personalities. The truth? Nope. That's a different condition entirely. Dissociative identity disorder, schizophrenia has nothing to do with DID or split personality.
So, what is it then?
Schizophrenia is a chronic brain disorder that affects how someone thinks, feels, and interprets reality. Some people hear voices. Some people see things that aren't there. Some hold beliefs that feel absolutely real, even if no one else shares them.
And from the outside, it can look like weird behavior or aggression, but it might actually just be terror or confusion.
Totally. And we don't talk about that enough. The human part, what it feels like to question your own reality, to not know if your thoughts are yours, and then to be treated like you're dangerous or broken instead of scared. Let's hit a few more facts while we're here. One in 100 people worldwide live with schizophrenia. That's over 24 million people. And that's according to the World Health Organization. People with schizophrenia are 14 times more likely to be victims of violence than to commit it.
That's huge. We think dangerous, but most of the time, they're the ones in danger.
Exactly. The real crisis isn't violence, it's neglect, lack of housing, support, community, people living with untreated symptoms because the system failed them. And here's one that breaks my heart. The average life expectancy for someone with schizophrenia is 15 to 20 years shorter than the general population. Not because of the illness, but because of suicide, heart disease, and poor access to medical care.
God, I've seen that. I've had patients in their 30s and 40s who already seem so worn down by everything.
So, this episode is for anyone who's been judged, locked up, or dismissed just for having a mind that works differently. It's for the families who don't know what to call it, and for the providers who want to help but weren't trained to understand what they're seeing.
That's me. I want to try to learn everything I can. That's why I'm always calling you and asking you, what is this? What would you think if you saw somebody who was acting like this? Because the overlap between detox and mental health is huge. And most people that I see, no one's ever explained this to them.
And most of the time, no one ever explained it to us either. That's why we're doing this. So, in this next segment, we're diving deep into what schizophrenia actually is, the spectrum, the symptoms, the parts people never talk about. So, now that we've covered what schizophrenia actually is, let's talk about when it starts and why so many people get missed.
Yes, I have so many questions about this. Because in detox, I've seen young people come through with signs that might be early psychosis, but nobody's sure. They're just called non-compliant or behavioral or just attribute it to them being on substances.
That's exactly the issue. Schizophrenia often begins quietly and painfully in the background of someone's life. The average age of onset is late teens to early 30s, often earlier in men and a little later in women.
What does it look like at first?
So, some early warning signs. Great question. Early symptoms can be subtle and are often mistaken for just being a teenager or going through something. And here's what we might see: withdrawing socially, just like suddenly isolating, losing interest in things they used to love, talking in odd, disconnected ways, becoming paranoid or overly suspicious, flat emotions or unusual reactions, and then subtle changes in hygiene, motivation, and or behavior.
Yeah, I've definitely seen those, but I feel like most people just chalk it up to anxiety or trauma or substance abuse, especially if there is a history of abuse.
Exactly. And that's why it is so important, honestly, to treat every individual as case by case and to gather as much information and history as you can.
Yeah, it's not
Um,
cookie cutter for sure.
exactly. Yeah. And that brings us to one of the biggest reasons schizophrenia gets misdiagnosed or ignored. Trauma, autism, and mood disorders can look like psychosis. One study found that nearly 50% of patients with early psychosis had previously been misdiagnosed with depression or anxiety.
That makes sense. In detox, I've had patients who were hearing voices, but when I asked, they'd say it started after something traumatic. I always wondered if that made it PTSD instead.
And you're not wrong. Trauma can cause hallucinations, especially in complex PTSD. But here's the clinical difference: in PTSD, voices often sound like the abuser or echo trauma related content. In schizophrenia, the voices may be unrelated, like a running commentary or commands.
Okay, wow. I mean, I've never really had anybody break it down to me like that. So it's not just what the voices say, it's why they're there and what kind of voices they are hearing.
Exactly. And when we don't ask the right questions, we miss the pattern. Here are some of the top conditions schizophrenia gets confused with. And I know that we've talked about this a lot. Bipolar disorder, especially if there's mood swings and psychosis from the mania from bipolar 1, depression, particularly if negative symptoms are mistaken for flat mood, PTSD due to hypervigilance, dissociation, or intrusive thoughts, autism, especially if there's social withdrawal or unusual speech patterns, and then substance use disorders. If someone is self medicating or already in withdrawal.
That's so real. I've had young men come in looking agitated, hearing things, and no one knows whether to call it meth psychosis or early schizophrenia.
Totally valid. And the truth is, sometimes it's both. Substances like meth or synthetic cannabinoids, and you've seen xylazine, I've seen xylazine reactions in
Yeah.
the ER, can trigger psychosis, but they can also unmask a latent schizophrenia diagnosis. And this is where we have to say it plainly. The system often fails people at the moment early intervention could matter most. The average delay between first symptoms and first treatment is 12 to 18 months.
That's over a year of slipping through the cracks.
Yep. And during that time, people are often labeled as difficult, lazy, non compliant, or just being dramatic. And if they're poor, uninsured, or black or brown, they're more likely to end up in jail or the ER than in a clinic or actually getting the help that they need and deserve.
Yeah. So is there a point where it's too late to treat, or is earlier just better?
Earlier is always better. There's a concept called duration of untreated psychosis, also known as DUP, and the longer it goes untreated, the worse the outcomes. Early intervention programs like coordinated specialty care have shown that with support, many people improve dramatically, sometimes even returning to school or work.
We definitely need more of that. I feel like by the time I see people in detox, they've already lost trust in the system and in just humanity itself. And they've been dismissed so many times. They really stop trying to explain what's going on, how they're feeling, and they just dismiss it themselves.
You're so right. Alive. So if someone's behavior feels off, if they seem disconnected or distant or paranoid, ask gently, compassionately, without assuming, because you might be catching a glimpse of something that's been there a long time, just never named.
This is so needed. I'm thinking of people I've seen who weren't just crazy, they were scared. And no one, not even me, asked what was underneath the symptoms.
Yeah. And coming up next, we're talking about what it's really like to live with schizophrenia, not the diagnosis, not the stereotype, the day to day reality of hearing voices, losing insight, navigating medication, and still trying to be human in a world that doesn't understand.
Okay. And this might be a weird flip side to what we've been talking about, but I've had so many people come through detox saying they've been diagnosed with schizophrenia. And I'm sitting there thinking, no, you haven't. That's not what this is. Like they'll have trauma or be coming down from meth or even just struggling emotionally, but someone somewhere told them they were schizophrenic and they've internalized that label. I'm telling you, probably about 80% of the people that I'm doing an assessment on, they say, I have schizophrenia. I've been diagnosed with schizophrenia. And I just think to myself, I don't think that's true. And then they hold on to that diagnosis forever and it's stuck with them forever.
Yes, yes. Thank you for saying that because the pendulum doesn't just swing one way. People don't just get missed, they also get misdiagnosed, especially in detox, jail, or psych ER settings. When someone is hallucinating, agitated, or paranoid, the default is often, this is schizophrenia." But what if it's trauma induced dissociation or meth induced psychosis or withdrawal related hallucinations or personality disorder with stress induced symptoms or even a manic episode?
Exactly. I've had patients tell me that they've hallucinated for 24 hours and someone slaps a schizoaffective label on them without ever checking back in later and just leaving them with that.
And the harm of that, it's huge because once that diagnosis is in their chart, it follows them. People stop asking questions. They stop listening. And the person starts to believe it. They start to believe, I'm schizophrenic. I'm broken. There's no point in trying. In one study, over 25% of schizophrenia diagnoses were found to be incorrect when evaluated with structured clinical interviews. So, yeah, misdiagnosis can go both ways. Some people are psychotic and nobody sees it. Others are not psychotic, but the system treats them like they are.
And that's what makes it even more important to just take your time with the patient. Take the time to ask them about timing and trauma and drug history and family history and just listen to them. I feel like sometimes we get so caught up in pushing patients through and making sure we can see so many patients a day that we forget to just take the time to listen to them and really hear what they're saying.
Absolutely. And then that brings up an entire other episode, honestly, about what insurance reimbursement and just what our current laws and all that kind of allow for. It's basically our field, our system, our healthcare in general is structured in a way that is rushed in what you just described. So, because a rush label can do more damage than no label at all. So now we've talked about the diagnosis, the early signs, and how people get missed or mislabeled. But let's shift into something even more important, what it's actually like to live with schizophrenia. Because this isn't just about symptoms, it's about experience. And for a lot of people, it's a quiet daily battle just to stay connected to reality.
I really want to understand this part because once people leave detox, I don't always know what they're going home to or how to support them if their symptoms continue. So, what does it look like day to day?
Good question. So, for most people with schizophrenia, the most recognizable experience is auditory hallucinations, usually hearing voices. But it's not just hearing things, it's hearing things that feel real. Sometimes external, like someone whispering behind you. Sometimes internal, like a thought that's not your own. Up to 80% of people with schizophrenia hear voices. And those voices, they might be cruel. They might command you to hurt yourself, or they might talk about you, narrate your every move, narrate your life, basically, or mimic someone from your past.
That's heartbreaking and scary. And honestly, I've had patients tell me about that, but I think they were too scared to go into detail. Like they thought I'd panic or write them off or not listen to them.
Yeah, because you think about people too who are hearing the voice of their abusers, their past abusers, and things like that. I know we talk about that with PTSD, but I'm sure that crosses over. And it would be extremely difficult. Extremely difficult. Doesn't even describe it. People learn fast that when they describe their symptoms honestly, they often get punished, restrained, medicated, or ignored. So they stop telling the truth. And then there's delusions, fixed beliefs that don't align with reality. Some people believe the government is tracking them. Some think their neighbors are spying or that strangers are reading their thoughts. To outsiders, it seems crazy, but to them, it feels completely real.
Yeah, when something like this happens, I have a client who is having delusions. I never know how to handle that. Do you challenge those beliefs in therapy, or do you just let them talk and tell you what they're feeling and thinking?
Yeah. And I understand that. And it depends. Sometimes trying to confront a delusion directly just creates more fear. Instead, we try to build trust first, then gently explore what it feels like to hold that belief or what it would mean if it weren't true. So basically, gently suggesting the reality, gently suggesting alternatives that could very well be possible because that just helps them kind of work through it. And you're not being confrontational and you're not just being dismissive either. Because that can make them much more paranoid. And then they think you're possibly in on whatever's going on or you're an enemy.
It's like we talked before, having a good rapport and setting that trust and making sure they trust you is so important.
Exactly. And we don't always need to convince someone. Sometimes being seen and heard is the first layer of treatment. Sometimes I think if someone's been struggling for a while, what's the hurry? But you have that time to build the rapport a little bit, get the ball rolling in the right direction, and just start to get to know somebody.
Right. Because if they feel like they can trust you, I feel like they are going to put more out there each time.
Absolutely. And just open up to you. And that is how you can actually start to help and they can start to heal. And that's where all the good stuff is.
Yeah.
So there are parts of schizophrenia that people don't see. And those can be the hardest. The flat affect, where it seems like someone doesn't care, even when they do. The lack of motivation, not because they're lazy, but because their dopamine system is impaired. The cognitive fog, where even simple tasks feel overwhelming. And that reminds me of an ADHD brain. Studies
Yeah.
show studies show that cognitive symptoms are a stronger predictor of long-term disability than hallucinations or delusions.
So even if someone's voices are gone, they still might not be okay.
And my mom always has told me that and tried to explain that to me. Recovery isn't just about symptom reduction. It's about rebuilding function, confidence, and life. And that's with everything. You can never go back exactly to how things used to be, but you can start to learn how to manage your symptoms and an amazing life, live your best life despite that.
Can we talk about meds for a second? Because I know antipsychotics are important, but I've also had patients in detox say they hate how they make them feel, like flat or zombied out, or I just don't feel anything and they hate that feeling. They want to be able to
Mhm.
feel.
That's real. That's real. The numbness, absolutely. The zombie, I hear that. I've heard that from people who sit down for their initial appointment and tell me, oh, that medication made me feel like a zombie. That
I never want
definitely
to feel
heard
like
that.
that again.
Yeah, exactly. They would rather feel too high, too low, rather honestly cycle and be all over the place than feel nothing at all, which
Yeah.
I get that. So, with that being said, antipsychotics can be life saving, but they do come with side effects like weight gain, sedation, movement disorders, sexual dysfunction, emotional dulling. And the reality is, for some people, especially those who've experienced trauma, taking a med that dulls their mind or slows them down feels intolerable.
So, what do you do then?
Collaborate like we do. Start
Yeah.
low, go slow. And most of all, Involve the person in the decision. The client needs, it's essential that they feel empowered, that they are an integral part of their treatment plan and that they know what's going on at all steps. They don't feel that anyone's going behind their
They're
backs.
trying to hide anything.
Yeah, it's them, it's their life, and it literally is, and they should feel that way because compliance doesn't come from threats. It comes from trust.
Absolutely. Yes, 100%.
Mhm.
One more thing. I've had people swear up and down that nothing's wrong with them, even when everyone else sees it. Do you think that's denial or is that part of the illness?
It's called anosognosia, and it's neurological, not denial, not defiance, just a brain that can't register something's wrong. Around 50 to 60% of people with schizophrenia experience, and that can make treatment incredibly difficult. You can't force someone to take meds or go to therapy when they genuinely don't believe they're ill.
So families feel helpless and providers just give up. I've seen that multiple times where providers are like, well, it's not illegal to be crazy. So,
Yeah, definitely. Which is why we need systems built on support, not punishment. Because living with schizophrenia is hard enough without the world turning its back. So, yeah, living with schizophrenia is about way more than voices. It's about navigating a world that often doesn't understand and doesn't try to. This episode doesn't even begin to touch on it.
yeah, it just makes me want to show up differently. We have
Yeah.
talked about this topic so many times because it interests me and there's just so many different things. I see my patients and it just makes me want to learn more, ask people what their voices say, ask what's hard, ask what helps, not just chart their symptoms and move on. And talking to you about it really helps me do that. I feel like I'm a better provider having this information and being able to point them in the right direction of where they need to go after they're done in detox and what resources I can provide them.
Absolutely. And I know, but you are and always have been a great person, nurse, listener, provider. Like you have told me before, you might not always know like the right thing to say, or you might get nervous, which I don't see that. But you've told me that,
That I'm
and
a horrible communicator.
it's not true. But you're a great listener and you always take the time to listen to people. And that's seriously just so important. And that's it. That's the work. Coming up next, we're going to talk about the systems that fail people with schizophrenia, the ERs, the jails, the shelters, and how we keep using crisis care as a substitute for actual support. So, we've talked about what it feels like to live with schizophrenia, but now we need to talk about the part that's not in the DSM, the part that isn't clinical, but still kills people. Because even if someone gets the right diagnosis, even if they want help, where do they go? Who's actually ready to hold them long term?
Yeah, I feel like this is where I feel it the most in detox. We stabilize someone, get them feeling better from a detox standpoint, maybe get them started on some medications and see our PMHNP. But when it's time for them to discharge, there's nowhere to send them. No housing, no psych follow up, no one answering the phone, just no resources. And half the time, I just don't know what to do and like what direction to point them in.
And that's not just a gap in care, it's a trap. People with schizophrenia get stuck in a system that's built for crisis, not for continuing care. So, another Mythbusters System Edition. The first myth: people with schizophrenia just don't want help. And that reminds me of like homeless individuals. They just don't want help.
Yeah.
Many people do want help, but they're navigating a system that's fragmented, underfunded, and often stacked against them.
Yeah, because if I don't know where to send somebody, they're not going to know where to go to get help.
Exactly. Another myth: there are resources out there, they just have to use them. The truth is that resources are scarce, especially in rural areas, rural communities like where we live, full of red tape and often require stability, transportation, and paperwork that people in crisis don't have.
Yeah, I can tell you I had a client talk to me about their mental health, and she had just had a short relapse and how her triggers are related to her mental health. And she's
Mhm.
like, I just moved here from a different state and I am on a waiting list for 7 months to get in to see a psych
Oh
provider.
my gosh.
Yeah.
Tell her to call me. Tell her to
Yeah.
call me and we'll try to figure something out. Shift openings.
Yeah.
Another myth, another myth, at least the hospital keeps them safe. The truth: psychiatric holds often last 72 hours or less. And people like to use that as a broad 72 hours, but it really does vary greatly from state to state. And there's a lot of different laws and things that you have to take into consideration. But many people are discharged. Ultimately, that's the bottom line. Many people are discharged with no plan, no meds, and no place to go.
Yeah. That last one. We have seen that way too often. We do
Mhm.
emergency work and then someone ends up back in the same dangerous situation they came from. We act like the ER is a treatment center, but it's not.
Yeah, and that's going to get its whole own episode, and you should come on that episode as well.
Yeah, absolutely.
Because ERs are holding tanks, not healing spaces. The ER has become the default psych facility, and that's not what it's meant for. A 2017 report from the American College of Emergency Physicians found that people with serious mental illness waited an average of 18 plus hours in the ER, with many waiting over 48 hours for a psych bed. But gosh, we've seen
Oh my God. 7 days.
those numbers are
Bed.
laughable, which is very sad.
Yeah.
And ER staff, most aren't trained for long-term psychiatric support. They're trying necessarily to work in mental health. They are working
Right.
in the emergency department.
Right. It's not their fault that they aren't trained for that. They're trained, get these people in, stabilize them, and get them out. Used to giving
Mhm.
people maybe 2 hours, I feel like.
Yeah.
I just feel like they're also overwhelmed. They're dealing with strokes, overdoses, trauma, codes,
Yeah.
things like that. And then they have psychosis on top of that. And half the time they don't even really understand.
Like I said, there's a whole episode,
Yeah, I could talk about that for hours.
So we're burning out staff and just abandoning patients at the same time.
Right. Not
Jail,
intentionally, but it just happens.
it's the system. It's how it trickles down. That's how the cookie crumbles. Like, yeah. Jail and the street become the only options. So nearly 1 in 3 people experiencing chronic homelessness live with a serious mental illness. And among incarcerated populations, over 20% have a diagnosed mental health condition, many undiagnosed or untreated before arrest.
And honestly, some of my patients prefer jail. At least there's food and meds and a bed.
It's terrifying when jail becomes a person's most stable environment. And I've definitely heard that too.
Yeah, like when they don't even bat an eye, like they enjoy going.
Okay. Yeah. Okay. But especially in the winter, which is crazy, but the seasons make a big difference. And you notice that
Yep.
when you're in the ER too. But that's what happens when we don't invest in outpatient psychiatry, case management, or supportive housing. We leave people to fall and then punish them for falling.
I've seen this pattern again and again. Psych ward, detox, ER, jail, street, and then back again. We treat people in pieces. No one sees the full story. No one asks the questions.
We call it the revolving door. And it's not caused by the diagnosis, it's caused by the system. People aren't non compliant, they're unsupported.
Say it
That
again.
reminds me. It's like, how are people supposed to just non compliance? I think about, obviously, we're prescribers. I think about people not taking their medication, but they're just not sticking to their treatment plan. But how can somebody take their medications if they can't afford them? If they don't have a ride to the pharmacy or transportation to the pharmacy, and then they have no money to purchase the medication, they don't have, it just becomes so difficult for them. And people forget to put themselves in their shoes, and then they think that everything is just
so easy and rainbows and butterflies, and it's not like that. Some
for
people,
everybody,
like you said,
right?
like struggle to even get a ride to the pharmacy or get a ride to the appointment even.
Yeah.
So yeah, so
Yeah.
undersupported.
And honestly, we asked them to do things most of us couldn't while
would struggle to do, too.
hallucinating. Yeah. While they're hallucinating, broke, traumatized, and just scared out of their minds.
Yeah.
Schizophrenia is already hard to live with, but the way the world treats it, that's what breaks people. We discharge people into housing crises. We medicate them and then strip away access to follow up care. We build safety nets with holes big enough for entire lives to fall through.
Yeah, it just makes me want to go back through every patient I've ever seen who came in with that diagnosis and ask, what system failed you? Because I'm starting to see it wasn't them at all. It was us.
Exactly. Coming up next, we're shifting the lens again because for all the hopelessness we talked about, there is a way forward. I said that earlier and I meant that. But we have to lay it all out. And that's how these episodes are going to be. Because recovery exists, not always loud, not most of the time linear, but absolutely possible. So let's talk about what that looks like and how healing might sound different than what we were taught to expect. Okay. We've talked about the worst of it, the symptoms, the stigma, the system failures, dropping the ball left and right. But let's pause here and talk about something that doesn't get said enough. Recovery is real. It's not always dramatic. It's not always linear, but it does happen.
Yes. Because honestly, when I was in school, schizophrenia was framed as hopeless, like lifelong, severe, limited function. But I've seen people get better. I just don't always know what helped them get there.
And that's the shift we need. Recovery doesn't mean being symptom free. It means having tools, having awareness, having support, and having purpose. Sometimes it means still hearing voices, but knowing how to respond to them. Sometimes it means working part-time, reconnecting with family, finding one reason to keep going. So let's myth bust this idea real quick. People with schizophrenia can't recover. People can and do recover. Not always in the way we imagine, just like everything else, but in powerful, meaningful ways. Recovery might look like having fewer or less distressing symptoms, building insight, or learning self regulation, finding a therapist you trust, rebuilding daily routines and relationships, and learning to live alongside your brain, not against it.
That's so different from the textbook version. I've seen patients learn to recognize triggers or say, I think an episode's coming. That's huge, right?
It's massive. That's insight. That's emotional regulation. That's recovery. There's a growing toolkit of supports that can actually help people with schizophrenia live full lives. Let's walk through a few. One is CBT for psychosis. It's CBTP, and it helps people reframe thoughts, reduce distress from voices, and challenge beliefs without confrontation. It works best when combined with medication and long-term support. The second, supported employment and housing. So programs like individual placement and support, IPS, help people find and keep jobs. Housing first models provide stability before requiring treatment compliance because they understand, and that's a big part of understanding when treating clients who suffer from any severe mental illness, that if they were organized and punctual and compliant, they might not be even having this conversation. It probably wouldn't be as big of a deal. It's difficult for them by design. We have to keep that in mind. IPS participants were twice as likely to gain competitive employment than those in traditional vocational rehab. And the third is peer support and hearing voices networks, run by people with lived experience, and they offer hope, connection, and validation without pathologizing everything.
I didn't even know that existed. So people who hear voices meet and talk about it, like a support group.
Exactly. Yeah. They don't start from you're broken. They start from you're not alone.
Which is huge because I feel like most of these people feel like I'm alone, everybody else is normal, and this is just I'm crazy, basically. I feel like
It's such an isolating, alienating mental illness. Yes. And just any severe mental illness is like that. It makes you it makes you feel like you don't belong in a lot of settings, and it's hard. It's very hard. And it's already hard to connect, and then you have that going on. So
yeah.
people also heal through art, music, and writing, family psychoeducation, because that just enhances the support system. And that is such a big thing, such a big deal, having a strong support system. Trauma informed therapy, internal family systems, IFS, and somatic work, especially for those with overlapping trauma.
So it's not just meds and it's not just hospitalization.
Medication can be a tool, not the whole toolbox. And sometimes the real shift happens when someone feels safe enough to say, I'm not my symptoms. I'm not crazy. I want to try again. Here's something I'll never forget. A client once told me, I still hear voices, but now I talk back. And another said, they used to feel like enemies. Now they're more like roommates. I don't love, but I can live with. That's recovery, not silence, not perfection, just resilience.
Yeah, that just gives me chills because I think so many people are probably waiting for the voices to stop. And if they don't, they probably think that they failed, that, they're never going to live a quote unquote normal life.
Exactly. And my mom has always told me that the reality, my brother too, has told me the reality is that sometimes you cannot eliminate the voices, but it's better to just accept, work on it, try to decrease them as much as possible, but also accept that it may never be perfect. And that's okay because you're doing something so amazing and admirable by getting through it and persevering through it. So that resilience is just unbelievable. But managing symptoms, reducing harm, rebuilding self worth, that's all progress. And the providers who get that, they change lives, not because they fixed someone, but because they stayed long enough for that person to find their own way forward. So, yeah, recovery is possible, but it's not just up to the person living with schizophrenia. It's up to us as providers, systems, and humans to build a world where recovery is even allowed.
And honestly, I want to be that kind of provider. I think I'm finding my way and becoming that provider since I am a new APP. I just want to be the one
Right.
that doesn't give up when someone relapses, the one who says, okay, let's try this again. We're going to do this together. And I know I have repeat clients that come into detox who are so embarrassed to come back in because they're like, you guys are going to judge me. I'm going to be judged. I'm upset that this happened. But in the long run, they knew what they needed to do to be where they wanted to be, to come in and get the help that they needed. And I think that's huge. And I would never judge anybody for that. I just want to be able to be there and watch them be better and be where they want to be.
Yes. And that is so powerful what you said, like everything you said, but let's try again together. And that's the kind of provider that you and I strive to be for sure. And there's so much power in community and support people might not even realize. Coming up next, our final segment, what we don't say about schizophrenia, the taboo truths, the grief, the genius, the deep humanity that often gets erased. There's one more layer to this that we haven't touched yet. And it's not about diagnosis or treatment or meds. It's about what we don't say. The things that don't fit in a chart, the things that hurt too much to name. Because schizophrenia isn't just misunderstood, it's often,
I feel that. Even when I talk about patients with compassion, there's always this unspoken heaviness, like everyone in the room assumes they're too far gone. And I hate that because I've met some of the most brilliant, sensitive, complex people who've been labeled as hopeless.
yes. And that's what this segment is for, the grief, the contradictions, the quiet truths no one prepares you for. And the grief no one talks about. For some people, especially family members, schizophrenia feels like a kind of mourning. They miss the version of the person they used to know or the life they imagined for them. And no one tells them how to hold that grief without turning it into resentment.
And that hits hard. I've talked to parents who say, he used to be so funny, or she was so smart in school. And they say it like that person died. And that's dark.
And in a way, they did, or at least the version they knew. And it can feel like that. But the person who's here now still matters. They still matter. They still deserve dignity. They still have joy in art and humor and pain, just differently.
And they just need that support.
Yeah. Yeah. And the hope that, like you said, that whole kind of like vibe and tone shift around it doesn't have to be all dark and rainy.
No.
Does not have to be.
I
Here's
think the
another,
word is scary to people. I think that's a big thing.
yeah, absolutely. And that's part of the stigma. That just goes back to history and our ancestors and the things they experienced.
And that's
You know,
why
the
we're
state,
doing
yeah, for
to
sure. Right.
educate people so they know.
Mhm, to reframe it.
Write it.
Rewrite it, rewrite. Here's another thing no one tells you. Some of the most profound thinkers ever were psychotic. People whose brains broke patterns no one else saw, who connected ideas in like non-linear, poetic, almost spiritual ways.
Yeah, I've seen that too. Like someone who sounds very disorganized at first, but then when you listen a little longer and take the time, it's actually really deep, almost like philosophy mixed with chaos.
Right. We don't talk about enough about the genius that sometimes lives inside madness, or the sensitivity, or the emotional overload that comes with feeling everything at once and not being able to shut it off. Studies have shown that people with schizophrenia often score higher in creative associative thinking and divergent problem solving, especially before symptom onset. And then there's the part that breaks my heart the most. The people who know they're losing touch with reality, but can't stop it. They're not delusional yet, but they feel it coming, like being pulled underwater while everyone else is on shore watching.
Yeah, and that's such a specific kind of pain. I think we all assume people don't know what's happening, but maybe some of them do. And that's worse because they do know what's going on.
Exactly. And that early insight, it's rare, but when it shows up, it's one of the most painful things I've ever seen. Let's be honest, even in healthcare, people pull away when they hear schizophrenia. Like you said, it's one of the few diagnoses that makes providers like freeze, back up, or just
Like,
change their
wait a
tone.
minute. Yeah,
Yeah.
that's real. I mean, people are more comfortable talking about depression or anxiety or even bipolar, but say schizophrenia, and it's like the whole room shifts. Like a
And
heaviness
that,
comes over that.
right. And that fear, it gets internalized. So that heaviness, yeah, it gets internalized. So the person living with it starts to believe I'm too much. I'm scary. I'm broken. No one will ever stay. And that's what hurts the most. Not the symptoms, but the shame.
And it's crazy that one word has that much power.
Can you think about there has to be a lot of history behind it, for it to be
Mhm.
that way. You want to know what I've learned? That living with schizophrenia is a kind of courage most people will never understand. That's what I was saying earlier about the admiration, because getting out of bed when the voices say you shouldn't, taking meds that make you tired but keep you safe or keep you stable enough to be safe for your family, or showing up to therapy after being told you're untreatable, and just, how everybody has that hopeless dialogue around your condition and you still show up and still try despite that. It would be tough. And that's not weakness. That's not failure. That's resilience in its rawest.
That's so powerful. And I want to remember that just existing with schizophrenia can be an act of bravery.
Absolutely, yeah. So the next time someone says they're schizophrenic, correct them. Say, you mean they're living with schizophrenia, because they're still a person. They're still here. They're still trying. And sometimes trying is the victory.
Coming up next, our final segment, the hope, the future, what we can do as providers, friends, and systems to make things better.
We've said a lot in this episode, and honestly, some of it was hard, but if you've stuck with us this far, I want you to hear this part clearly. Hope is not naive. Hope is not dangerous. And hope is not delusional.
That's such a good way to say it, because I think a lot of providers, even well meaning ones, quietly give up on people with schizophrenia. They lower the bar, they assume things won't change.
Right. You're right. But what if instead of asking, can they be cured, we started asking, how can we help them build a life they actually want to stay for?
Yeah.
There are programs making a difference. So let's take this time to spotlight a few. There's the coordinated specialty care. I think I mentioned that earlier. It's CSC. They combine psychiatry, therapy, family support, and employment coaching for early psychosis. It reduces hospitalization, increases work, school reentry, and just improves overall quality of life. PTSD programs have been shown to cut relapse rates in half compared to standard treatment, which is impressive. Open Dialogue, which is based in Finland, and they have global programs, but they focus on relationships, not just symptoms. They bring in family, community for collaborative healing. And some regions using this model report much lower use of medication and hospitalization with better long-term outcomes. And these, if nothing else, are programs that we can model our own programs after or just learn from.
Yeah. And that's the kind of care I wish we had in detox: holistic, patient led, less about control and more about connecting with the patients.
Yes. And those models work because they believe people can recover, and they build systems that reflect and support that. Because what because here's the reality check. Access to these programs is limited. Most people, especially those without insurance, housing, or support, still fall through the cracks. And for people of color, immigrants, and those with past trauma, the risk of misdiagnosis, over policing, and forced treatment is even higher. Black individuals in the US are nearly 5 times more likely to be diagnosed with schizophrenia and more likely to be hospitalized involuntarily.
We've got to name that, because it's not just about psychiatry, it's about racism, poverty, bias, and fear. And if we don't address that, nothing changes.
You're so right. True hope doesn't ignore reality. It fights for a better one. So maybe you're listening as a provider or as a loved one or as someone who has been diagnosed and is trying to figure out if there's still a future for you. Here's what I want you to know. You are not your diagnosis. You are not your worst day. And you are not broken beyond repair. Recovery might look different than what you imagined or what you've been led to believe. It might be slower, messier, more nonlinear, but it is possible.
And if you're a provider like me, please don't underestimate your impact. Ask the extra questions, give the person 5 more minutes, stay curious instead of scared, because sometimes that's the moment that turns everything around.
Yeah, yeah. And living with schizophrenia is not a failure. It's not a curse. It's a human experience that deserves empathy, science, support, advancements, and imagination. Some people live in two realities at once. And the bravest thing they do is stay. So let's build a system that's worthy of that kind of courage.
Thanks for being with us today, wherever you are, whether you're healing, helping, or just beginning to understand. We see you, we're with you, and this is where the rewrite begins.